afternoon, everyone. My name is Tara Kangarloo, and it's so good to be back in the afternoon session of our interviews at the 7th Annual Concordia Summits here in New York City. Right now, I have the great pleasure of having Ambassador Deborah Brix, U.S. Global AIDS Coordinator and U.S. Special Representative for Global Health Diplomacy at the U.S. Department of State. And while at CDC, Ambassador, you were responsible for all the agency's global HIV and AIDS activities. Welcome to the program.
Thank you. Happy to be here.
Thank you so much for your time. AIDS and HIV issues always fascinated me. When I was young, actually, growing up in Iran, I had the opportunity to work with two pioneering doctors who were very active in this field, just going around in high schools and talking about HIV and AIDS prevention. And this was Iran a long time ago. So why is it that even in the United States today we have such a hard time talking about this issue? It's still taboo, it's still third rail, and it's not comfortable for everybody to discuss. So with that said, then how can we go forward resolving the stigma and then the disease itself?
Well, like what you started with about Iran, and really how critical it was that people knew their status, because that was the gateway to whether people needed prevention interventions or they needed treatment. And I think if we don't figure out, particularly among young people, because the epidemic around the globe is shifting more and more to young people. At this summit, we've heard about the potential of the demographic dividend, but it's only a dividend if the young people are healthy. And so really finding messages that resonates for people to understand that knowing their status is critical, and there's not going to be a judgment associated with even asking for an HIV test, because sometimes people will be like, why do you need one? So it's really important that we continue to work on that, and it comes down to parents really having those discussions with their children and really ensuring that their children are aware about the risk and how HIV is transmitted and how to protect themselves and how to keep from getting infected, and really having that piece, but also having a social media piece where children and young adults can get messages about what puts them at risk and how to keep from being at risk. So it's an exciting time with social media and the chance to really address these core issues.
And really to have a conversation about it,
yes.
Because the stigmas are already out there, whether in Middle Eastern countries or even here in the United States. Let's talk about some improvements. Your agency oversees a lot of work that's done in the space of prevention, but also essentially cure and there is no cure. Cure is not the right word, but mending to this disease. Let's talk about some steps that are ahead of us that excite you and the work you're doing at the Department of State.
Well, the exciting thing is I've gotten to see the amazing scientific discoveries as they happened. And so people always say, how do you know so much about HIV? I'm like, I lived it, so it's so much easier. I learned it in little pieces rather than all at once. And so the breakthroughs that we had in treatment in 1996, having the combination of drugs that would actually suppress the individual's virus so that they stayed healthy and they couldn't transmit the virus, the breakthroughs that we've had in prevention, and I think the last two breakthroughs that we need to actually eradicate and eliminate HIV are cure and vaccines, and the progress being made around the world towards a cure and towards a vaccine. There are trials ongoing right now in South Africa on vaccines that could be our next breakthrough. And so our job is to ensure that we have programs in every country where we support to ensure that we're decreasing the number of new infections and treating those who are infected so that we can control the pandemic in a public health way while the scientists, the brilliant pharmaceutical companies and NIH and others that are going to come through with a cure for us, because I believe it's possible.
Absolutely. One of the things that you oversee is global health diplomacy, and diplomacy is the key word here. How is it that the United States support in volatile environments, volatile countries, and developing communities that are not necessarily stable when it comes to conflict between different ethnic groups or local forces? How is it that your team works with them, and the importance of global health diplomacy in securing those places?
I think people often ask me, whose idea was it to put PEPFAR, which is part of a health program in the State Department? And I think it's just as you have talked about, it's the issues related to stigma and discriminations. It's understanding that you need political will and leadership at the highest levels of government, that you need community engagement, and of course then you need the resources. And I think the United States recognized that resources alone were not going to control the pandemic. They were not going to heal communities. They were not going to bring back the teachers and the doctors that we had lost along the way, but they were a way to start that dialogue between community, government, and those of us who are providing the resources. And we have such an advantage. I call it our secret sauce. We have ambassadors in every country who are willing to take on these key policy dialogues that you just talked about, the issues about gender and women's rights, the issues about sexual violence, the issues about access. That's what our ambassadors can do, not only for HIV/AIDS, but across the global health spectrum. And I think that's the diplomacy part. It's not always easy, but I think because we're really seeing progress, people see that policies create the enabling environment to make the U.S. dollars work. And that's the exciting part, I think, for American taxpayers and for us.
Speaking of American taxpayers and our dollar, Bill Gates recently said that President Trump's budget cuts will affect the United States' involvement in addressing HIV and AIDS. Now, by that, he was talking about the funding, the president's emergency plan for AIDS relief that may potentially be cut. Are you worried about that? And in that light, how is your agency working with the private sector to sort of teaming up and amplifying the effect of the work that you're having right now?
Two great questions. My job, for where I sit, is to take the president budget and put together the most impactful program that I can with those dollars. And so that's what we have done. We also have a relationship, and we've been very supported by the American people, by the presidents, because remember, this was a Republican program begun under President Bush, continued under President Obama, and further supported now, I think you heard in the speech this morning, by President Trump. And so there are dollars and then there's support to the program. So the support to the program has been continuous and really shows that in the United States, the two sides are working together, but that also happens with our Congress. And so our Congress works together to support this program. So my job is to make sure that every dollar that we're spending of my parents' money and my brother's money and my daughter's money and my money is really having the impact that the American people expect to us. But that's why we're excited about Concordia, because no matter how much progress we make, and we're very serious about our data and we're very serious about impact. So we track everything down to the client we serve. So we know what it costs and we know what it should cost and we know what we're spending. We work at that all the time. But the private sector has been so amazing, because 3 years ago we came here and we said we have a problem, we're not reaching enough children. And the private sector stood up with us and we doubled the number of children on treatment. 2 years ago we came and said, we have a real problem. Young women are being infected at 5 to 15 times greater rates than young men. And we need messages for young women that resonate with young women. And that's what started DREAMS, Determined, Resilient, Empowered, AIDS-Free, Mentored, and Safe Young Women. And Johnson & Johnson, Bill and Melinda Gates, Viva Gilead, and Girl Effect all came with us to help us. This year, and for the last 12 months, we've been talking about how do we see big data easy so that people can make data actionable. So people can see down into a community and say, okay, we need to do this, this, and this because these are the issues. So we brought that here, and we're getting answers from MasterCard, and we have one other big problem. Men under 35 who are healthy, who feel great, are actually at risk for HIV. And don't perceive themselves to be at risk, and don't interact with the health centers in most resource-limited settings, because there's no reason for a healthy man.
Sure, and that goes back to the issue that you should talk about.
Yes.
And really, this should be part of the general public health narrative in this country and beyond. Now, you have such energetic aura about you that I have to ask this question, because I think everybody watching this or knowing about AIDS and HIV wants to know, are we really close to a cure?
We are close.
Once and for all,
if we did what we could with the tools we have today, and we made sure that all those tools were available no matter where you lived in the world, for prevention and treatment, we can control the pandemic today. And we have evidence now of a whole series of countries, and we announced in our press release, 5 countries that have really halved their epidemic new infection rate. We just have to half it again, and we're very close in those countries. But that's control.
That's control, exactly.
And we need to eliminate and eradicate, and that comes with vaccine and cure. So we're going to do our part, and we're going to continue to push people like Tony Fauci and the NIH and all these brilliant researchers to get us to a vaccine and a cure. I think we can control it, but we also want to eliminate.
We have to eradicate it.
Yes.
And on that note, Ambassador Deborah Brix, thank you very much for your time.
Thank
it was a
you.
pleasure.
It's great meeting you.
Thank you.